Pneumothorax is basically the collection of air in the thoracic cavity, and it is a very complicated condition in itself. Again, there are a lot of basically management modalities that are related to this pneumothorax according to the type of pneumothorax that we are dealing with. The lung injuries are again discussed in this section as well. So basically this section comprises of the pneumothorax, what is pneumothorax, the types of pneumothorax that we'll be dealing with in different patients that are also discussed in this section, and then we'll be dealing with the injuries to the lungs. Now there are a lot of injuries. Again, it can be the sharp penetrating injuries, it can be the perforating injuries on the other hand, and we can have blunt injuries even to the lungs that can again have the super complications of hemorrhage and infection in the lungs. So these are all the criteria and the modalities that we are going to discuss relating to the pneumothorax and apart from the pneumothorax as well in this section. So basically, how do you define pneumothorax? It's basically the caused by the entry of the air into the pleural space, leading to sudden increase of the intrathoracic pressure. As in, what are the cases, what are the examples for this pneumothorax are? We have to basically emphasize on the fact that the air is not present in the lungs. We're not talking about air in the lungs. The air is actually present in the pleural cavity, the space surrounding the lungs, between the pleural surfaces. That is the space that we are talking about right now. So it has its own implications. The lung movement will be restricted in these cases. There can be infections, there can be hemorrhages. All of these are basically related to this pneumothorax phenomena. What are the cases that are basically dealing with these pneumothorax complications are the blunt chest injuries. And these blunt chest injuries are basically a part of the stampede phenomena in any crowded places, and again it can be a part of the road traffic accidents. So the sharp penetrating injuries, as we were talking about, are again very important in this sense. We can have blunt weapons on one hand, and we can have penetrating sharp weapons. Again, sharp weapons can be divided into single-edged and double-edged weapons. These weapons can basically penetrate or perforate the thoracic cavity, and that will be basically very debilitating for the patient. Then we can have a fractured rib. A fractured rib is basically a phenomena that we have already discussed. It can be a single fractured rib that is without any complications, and it is almost self-healing. And it can be a double or a multiple fracture in a single rib, which is going to give rise to a flail chest. And a flail chest is a very complicated condition. It has to be managed in its particular way because it is going to basically be very fatal for the patient, as it is going to lead the patient to continued hypoxic conditions. Then stab with a sharp instrument is again very important, and stab is basically defined as any injury which has a more perpendicular level rather than a linear level. So the more perpendicular the injury is, the more visceral structures it can damage in that sense. So we have to keep all these things in our mind. And the natural diseases, for example, it can be tuberculosis, it can be asbestosis, it can be pneumoconiosis. All these lung-related diseases can again cause this pneumothorax conditions, and we have to keep these in mind. So these traumatic conditions, these natural diseases, these malignant conditions are basically a part and parcel of this pneumothorax that we are discussing right now. Pneumothorax has a lot of types. Depending upon, we'll be discussing the underlying pathological conditions that the person is suffering from. We can divide it into three major types basically. Type 1 we'll be discussing, for example, the leakage through the pleura. So the first step while we are discussing the pathological underlying pathology is the leakage through the pleura, and then there is air entry into the pleural cavity. This is basically the plurals are basically involved in this pathological condition. Then the communication rapidly closes and the lung partly collapses. So here you can see in this diagram over here, it's basically the collapsed lung lying over here due to the pneumothorax. So this is basically showing that the underlying pathology is the major cause, how we differentiate between different types. This is very important. The lung partly collapses, and after this basically death ensues. And if death doesn't supervene, what can be the complication? The air is soon absorbed by the surroundings or by the lungs, and it can basically be a self healing process, and it can occur in some patients as well. Then it can also happen that the communication remain open, although there is air in the pleural cavity, but the communication is still there and the lung is still quite patent. Then we have the bronchopleural fistula with air in the pleural cavity. So this fistula is basically the communicating space that is formed between the pleura and the pleural cavity, and that will allow basically all the patency of the lung to happen. Now, you can just observe in this CT over here that there is not a bubble out by the autopsy, which is basically the water test that is performed in such pneumothorax cases. And the bubble out is basically the phenomena which is seen in the pneumothorax cases. The radiology demonstrate air in the pleural cavity, and this is again the highlight. The radiology is basically the diagnostic features are seen on the radiology that we are going to basically label a person whether he has pneumothorax or not. So these are the conditions that are occurring in the type 1 of pneumothorax that we were talking about. Then we have the type 2 of pneumothorax. What happens here in the type 2 pneumothorax is there is a leak in the pleural again, but the pathology over here is the valve-like action. The air is sucked into the pleural cavity and it doesn't escape on expiration. So it is not a self-healing process as it was in the first type, and is demonstrated at autopsy by penetrating an intercostal space under water. So again, we have a water test, we have a bubble test, and again the radiology is the highlight, and we will diagnose if a person had pneumothorax or not by the radiological findings that we have at our hand. Now, talking about the type 3 of pneumothorax, the injury of the chest wall communicates with the pleural cavity. The sucking wound may form with the direct passage of the air into the exterior. So the patency is quite more in this third kind of pneumothorax, and is usually seen in the military cases. It is complicated by the hemorrhage and the infections, and it is not at all a self-healing process as was the case in the type 1 of the pneumothorax. So these complications are basically quite apart when we are differentiating these type 1, type 2 and type 3 pneumothorax. And the more complicated kind of the pneumothorax is basically the type 3 pneumothorax. Now, the injuries to the lung. Now, any substantial impact on the chest can contuse the lung surface or the deeper part. So here you can see the hemorrhages over the lung surface areas that are seen, and the hyla of the lungs are basically the mainstay for the injuries. Any stab injuries that are penetrating through the hilum of the lungs, that is basically the entry route for the artery, for the veins, for the nerves, it's basically going to be more damaging to the lungs. The deceleration injuries, of course, we have already discussed the road traffic accidents in detail that are basically the main decelerating injuries. Whenever we are referring to the decelerating injuries, it is basically the road traffic accidents that we are talking about. So the bleeding and the hematoma is again another complication for these lungs. For the lung injuries. And the pincer contusions. Pincer contusions are basically the contusions that are formed through the blunt force trauma, and they have their own characteristic appearance, just as if they are jagging over the lung, and that basically appearance is known as the pincer contusions. And when we are talking about the lacerations, again, lacerations are, how do we define laceration from an incision? Incision is basically a more sharper and a clean cut edged wound, and lacerations are not that clean cut. They're basically more jagged in their appearance. So they can be more damaging as well for the lungs. These are the type of lung injuries that can be encountered by any person. So the penetrating injuries are more debilitating over here if we talk about them, and the complications, again, the hemorrhage, the infections are basically more and of a more severe type in these penetrating or perforating injuries. The blast injuries, on the other hand, are basically the mass disasters, and they are basically going to the shockwave therapy in the blast injuries is going to be more damaging to all the visceral structures, all the underlying structures. So the shockwave is the basic pathological phenomena whenever we are talking about the blast injuries, and they can basically be decelerating as well as accelerating. So these accelerating and decelerating injuries are basically a part of these blast or the mass disaster injuries whenever we are talking about them. Now, the injuries to the lungs are basically the destruction of the pulmonary encephalogram and the lung injury. It is the mainstay that is going to basically highlight that the lung had undergone any kind of an injury. Then the biotrauma. Biotrauma is basically the natural hazards that are usually present in our environment and that can contribute towards these lung injuries. And the hyperperfusion. So hyperperfusion is again another phenomena which it is basically an underlying phenomena, and whenever the lung basically hyperperfused due to any even pathological diseases that the person may already be suffering from, or any treatment modalities can also result in these hyperperfusion, and that will again cause a destruction of the pulmonary encephalogram. Then we have the oxidative injuries. Oxidative injuries are basically the injuries that are caused by the natural oxidants that are basically a part and parcel of our environment. So these can be also a part and parcel for the lung injuries and the destruction of the pulmonary encephalogram. Then we have the ischemia reperfusion injury. The ischemia reperfusion injury is basically the shock that can ensue in a lot of blood hemorrhage cases, and that will again result in the lung injury. The surgical trauma or manipulation, again, whenever we are treating a person, sometimes the trauma or the manipulation can be debilitating for the lungs, and it can rather be helpful for the patient. It can be destructive for the patient and can again cause the damage to the lungs. Then we have atelectasis. It's basically the restrictive kind of a disease that is seen in the lungs, and it is more of the occupational kind. Asbestosis, atelectasis, they're more of the occupational kind, and they are again basically modifying the lung structure, and they can be more damaging to the lung. Then overhydration, of course, in cases of submersion phenomena, and in drowning cases, lungs can be damaged. And all of these phenomena basically that are shown in this diagram are contributing towards the destruction of the lung. So these can be the highlights to the lung injuries and the other ways the lungs can be damaged rather than the trauma, the direct road traffic accidents or the direct trauma that the lung structures can encounter. So in this section, basically, we dealt with the lung and the lung injuries and the pneumothorax in general. So what are the types of pneumothorax and how can we deal with them? How can we differentiate between them? They are discussed in this section. That is the end to this section. Thank you for watching sqadia.com.